Hi, thanks for sitting along with me today. Today we're going to be covering urinary tract infections. So go ahead and grab your Davis Med Surg book, turn to page 1474, and make sure you have your Exemplar worksheet ready to fill out. Let's get started. Urinary tract infections are a very common infection. In fact, 8 million doctor visits annually are for urinary tract infections, and over 100,000 hospital admissions are linked to UTIs every single year. Now, this is more common in females than in males, and most common in females ages 18 to 30. However, older males are also at risk for this due to BPH, which we'll discuss in 119. There are a number of risk factors for UTIs, including sexual activity, diabetes, poor hygiene, and recent catheterizations like Foley catheters, indwelling catheters. Also, patients who are at risk for incomplete emptying of their bladder from things like uterine prolapse or BPH, because anytime that urine is stagnant and just festering and staying in the bladder, it's more likely that someone will get an infection from that. What is a urinary tract infection? Well, it's an infection of the urinary tract. Typically, it comes up from the urethra and enters into the bladder, and it can even ascend up into the ureters here. Most commonly associated with E. coli as the cause, but this bladder that enters this sterile environment causes inflammation. And inflammation is what causes all the signs and symptoms of a UTI. Remember that the bladder is sterile. That's why we use sterile technique when we do indwelling catheters. And so we don't want bacteria like E. coli creeping up into our urinary tract. So what are those signs and symptoms of urinary tract infections? Bladder irritability, bladder spasming, feeling like you need to go frequently but not much comes out. Dysuria, pain or burning with urination. Urinary frequency, urinating very often. Having urgency, once someone senses the need to go, they need to go right then. Urinating very small amounts when they do need to go. Gross hematuria, gross not meaning yucky, but gross meaning obvious. It's very obviously bloody urine. It can also have microhematuria, so blood in the urine that you only detect in a lab study, not just from looking at it. And then suprapubic pain. Suprapubic is very low abdominal pain, right above the pubic bone, and pain can happen there from UTI as well. So how do doctors medically diagnose UTIs? Well, they medically diagnose UTIs due to the signs and symptoms that the patients are reporting: urinary frequency, hematuria, dysuria, suprapubic pain. And then they can also send the urine test for a urinalysis and urine culture to grow it in a petri dish and see what kind of bacteria is growing. Urinary tract infections are bacterial, and so antimicrobial therapy, antibiotics, are ordered to help clear up these UTIs, as well as sometimes a medication called pyridium, which helps relieve some of the signs and symptoms of the UTI, some of the burning and the discomfort. Pyridium can help with that. While pyridium doesn't clear up the urinary tract infection, it can make patients more comfortable in the meantime. The interesting thing about pyridium is it will turn the urine kind of an orange color, kind of like Gatorade, and that orange color can actually stain the patient's clothing. So you want to teach your patients to expect that their urine might change colors, and maybe to wear some old underwear for a few days so that they don't stain their clothes. So, millions of people have these infections every year and are not hospitalized for it. So a lot of times patients come in, they complain of some burning, some urinary frequency, dysuria, hematuria. They go home on a round of antibiotics and maybe some pyridium to help with the symptoms, and then they do okay. But once in a while, these urinary tract infections can get worse. And some of the complications that can arise from that are drug-resistant bacteria. That means urinary tract infections, bacteria that don't respond easily to the antibiotics that are available. It doesn't kill them. Pyelonephritis is when the infection ascends up through the ureters and actually becomes a kidney infection, and we need our kidneys to do their filtration job, so we don't want those kidneys impacted. So pyelonephritis is an infection of the kidney. And you can also see something like a renal abscess, which is an infected pus pocket in the kidney. So those are some of the complications we want to avoid. The last complication that's not listed here is urosepsis. A sepsis is an overwhelming infection that it impacts the whole body, gets into the bloodstream, and is very difficult to treat, and if not treated early, can be fatal. And so patients can die of a urinary infection that's not treated, and it can overwhelm the body and turn into sepsis or septic shock. One thing I love about your Davis Med-Surg book is it really walks you through the nursing process for every exemplar that we're learning. So let's walk through the nursing process as it pertains to urinary tract infections. So the first step of the nursing process is assessment. What kind of signs and symptoms are you going to notice in someone who has a UTI? Well, it's going to be all those signs and symptoms related to the inflammation, the dysuria, the hematuria, suprapubic pain, urinary frequency and urgency, but voiding very small amounts. These are the types of symptoms patients will have when they come in complaining of a UTI. So then the second step of the nursing process is diagnosis. Not medical diagnosis, but what can we identify as the problem? And so some of those nursing diagnoses can be altered urinary elimination, a knowledge deficit perhaps if this is the first time that they're dealing with a UTI or some of these medications, and then certainly acute pain would be something that we could diagnose as nurses. So, interventions. Your Davis text divides the intervention step into 3 parts. Once you know someone has a UTI, then what do you need to look for and monitor? So interventions, the first part is assessments. What are you going to assess on a patient that you know already has this? And then it's going to talk about actions. What action steps are you going to take? And then it talks about patient teaching. What are you going to tell the patient? And all 3 of these fall under their umbrella of intervention. So let's look at the intervention step of the nursing process now. So the first one is assessments. Once you know someone has a UTI, these are the assessments you're going to make. You're going to check their vital signs. You're going to ask about those urinary symptoms, the burning, the pain with urination, urinary frequency, urgency, hematuria. You're going to do an abdominal examination, assessing, palpating for that suprapubic pain. You're going to send a urinary specimen to the lab for a urinalysis that can look for just bacteria in general or blood in the urine. And then you're also going to send it for a culture where they're going to grow that urine on a petri dish and see what kind of specific bacteria we're dealing with. So let's talk a little bit about that clean catch sample, because remember, we want to gather data that is accurate and valid, and so teaching our patients how to obtain a clean catch sample is important. So we're going to teach our patients when they're going to give us a urine sample. Often their urine specimen will come with a urine cup as well as a label, or maybe you'll provide a label, and some kind of cleansing wipe for the patient. So tell your patients to wash their hands before they start, and then wipe their genitals with that cleansing wipe. If the male is uncircumcised, he needs to retract that foreskin before cleansing. And if it's a female, make sure that she retracts the labial folds before cleansing. Then have them urinate a little bit into the toilet and then into the cup. And we have the patients void first a little into the toilet, because any bacteria that might be right around the urethral os, it'll help the urine, will flush that out, that'll go into the toilet, and so we'll get a real true midstream catch from the patient, and it's more reliable, because we're not interested if there's bacteria on the outside of their body, right? On the outside of their genitals, we're not trying to assess for that. So we want to know what's inside their urinary tract, and that's why we have to do these steps. Okay, so what actions do we take as part of the intervention step? Well, we're going to administer antibiotics as ordered. Remember, the antibiotics are the only thing that's really going to cure this. It's a bacterial infection, so we need antibiotics to cure this. We can administer those bladder analgesics like pyridium. Pyridium is going to decrease the irritative effects of the UTI, things like dysuria, frequency, and urgency. Pyridium's only used for about 3 days, just long enough to help with those symptoms while the antibiotics kick in. We also want to teach our patients to make sure that they are drinking lots of water. So we're going to push fluids, either oral or IV if they're in the hospital. Speaking of teaching, what are we going to teach our patients? Well, we're going to tell them to report any elevated temperature, flank pain, that's pain on their back, kind of on either side of the spine. If they're having any nausea or vomiting, those are signs that perhaps this infection is ascending up into the kidneys and becoming more of a pyelonephritis, or that it's not responding well to those antibiotics that have been ordered. So we should see the patient getting better and not getting worse. So we want to help them increase their fluid intake, making sure they're drinking lots of water, telling them about the signs and symptoms of urinary tract infections so that they can watch for those and report early signs next time, because if you've had one UTI, you're at risk for getting them again. Teach them about how to prevent UTIs. So things like don't hold your bladder too long. Make sure you're voiding when you need to. Don't take bubble baths, and make sure that you urinate right after sexual intercourse. And wipe yourself front to back for females. Those are types of things we can do to prevent UTIs from happening. And then, of course, we want to teach the patients about any medications that are prescribed. Finally, the nursing process ends with evaluation, evaluating what we did. Did the stuff that we did for the patient work? Is the patient getting better? And so the things we want to watch for are, do they have healthy kidneys? So we can look at lab work. So a normal BUN is from 10 to 20, and a normal creatinine is right around 1. So we want to make sure they've got normal kidney function, and that the kidney function has not decreased. We want to make sure that they're voiding regularly and at least 30 to 50 mLs per hour. And then that their symptoms have resolved. So we should see all of the symptoms go away. So they should no longer have hematuria or urinary frequency or dysuria. All those symptoms should resolve as the antibiotics kick in and are able to get rid of this disease. And that's all you need to know about urinary tract infections. I'll see you in class. Thanks for listening.